Hey beautiful people, it's your girl Frankie here, and today's video is more so of kind of how I study, some good studying tips. It's like part 2 because I got a ton of requests on my part 1. If you guys have not seen that, I will link that down below, but I got a ton of requests for a part 2. So I'm going to do this part 2. So I got a couple tips for you guys, and hopefully when you implement these work for you. But I'm telling you, when I used them during the bridge semester, which was last semester, it changed my life, most of it. You know what I'm saying? Because some of it I was already doing. But anyways, so I have a test coming up, but I wanted to get this video out for you guys in regards to the tips. It will be I will try to show more visuals in regards to what I'm talking about. So I hope you guys, I hope you guys really enjoy this video. Please don't forget to subscribe, comment, share, and give it a big thumbs up. If there are any tips that you have that have worked for you and you think they may work for others, just list them down below because we're here to help each other during this journey called nursing school. So without further ado, we're going to go ahead and jump into the video now. All right, beautiful people. The first thing I want to talk about is judging up your planner. You want to make it interesting. I know this is just pretty basic. I talked about why you need a planner in the first video. So I will link that video down below for my nursing tips, but I just feel like this is just important to include because it makes you just want to, look at your planner. So here I just have stickers, which I got my stickers from the Dollar Tree. I bought this pack first. This is the one I seen first. And this is more geared towards like bills being paid, reminders, note to self. And on the back, it is like holidays like Valentine's Day, Halloween, things like that. So it just say busy day, let's vacay. So it has some really good stickers. There's 300 stickers in this, and it is from Crafts Square. So I got this first, so those are stickers that you kind of see on the page. But then I went the other day, that's King. If y'all didn't know about my puppy, I'll put that video down below too about me going to pick him up. But the other day I found this one, which is geared more towards students, like more towards school. On here it has things like quiz, study, to do, and and then it has tests. It also has like if you have a due date for a paper or something, it has that. It has don't forget, reminder. On the back of here it has little kind of like little notebooks that say study, so you can put those arrows. Again, quizzes, stars, don't forget, study group. If you're in study groups, you can put that on there. School starts. So it has some pretty good things like summer break, fall break, finals. So I already used some of these stickers, but this is really good. So if you haven't been to Dollar Tree, definitely go to Dollar Tree. It's only $1 and you get 300 stickers, and it will kind of just help you. And if you can see in my planner, I just make each month like a different color. You can of course do it how you want to do it, but that's just kind of how I do it. And then I keep this little pencil holder full of like hole puncher, it's some whiteout, just pens, colorful markers and pens and things like that in there. So if I do feel like being creative and want to write some things out, I would do that. So this is basic, but I felt like I want to help those that want to decorate their planner more, to use their planner, because I was never a big person on using planners, but I definitely learned my lesson, and I have to find fun ways for me to want to kind of dive into my planner. And when I'm in class, a good tip is when you're in class, you want to have your planner. When you're studying, you want to have your planner next to you. You kind of just want to keep your planner with you everywhere when it's related to school, just because things may change and you might have to write it down really quickly, and you want to already just have your planner there instead of writing on a random piece of paper and then don't know where that paper is at. But I got this planner from Walmart for about I want to say like $7 or something like that. It wasn't very expensive, but it covers me all the way until, let me show you guys, because I have used this thing since I started in the spring, and it literally covers me all the way until December 2021. So all the way into next year. This is like kind of like a 20 to 21. So I started in January of 2020, and you know, I graduate in May of 2021. So this will cover me for the all of my semesters. So everything I've written down is in here. It's a 2-year monthly planner. So see it bigger, just in case you guys are interested in getting it. You can get the fancy ones if you want to, that cost like $20 or so from Michael's and all of that stuff. But I'm telling you, this does just as great, and it gives me more room because the boxes are bigger. So that is the first thing I kind of wanted to discuss. So the next one is asking questions. So these are a couple questions that I have put down for you to ask before your test. Question number 1 is, will there be a study guide? Question number 2, will there be a study session before the test? Or are you going to provide some practice questions? All right, so my next tip that I have, if your teacher has provided you with some type of study unit or study guide or something for you to look to get questions, which we just got some objectives that she said would help us with the test, then I want you to pull that out. What you're going to do when you pull that out is, one, if you are the type of person that likes to write, and you know, you can write really small if it's really small, then I suggest making sure you do it with a different color ink pen. Do not do it the same color. Why? Because it's going to look like this, and it's going to look very boring. You're not going to want to look at it. So that is my suggestion. As you can see, I tried to do that. I'm not really big on writing everything down. I really kind of suck at that. So I got really bored of this really quickly. So for my people that do not like to write all that down, honey, let me save you some time. Go ahead and just put the page numbers of where you found this at. All right. Why? Because you can look at it while you're studying, and you can go through these questions. Let me just pick out, I know, a question. Let's see. So if it says like, summarize the pre and post procedure care of the client undergoing the IVP, cystoscope, renal ultrasound, and renal biopsy, then I don't know why I said it like that. I'm all tongue tied. Renal biopsy. Then you can just go to those pages if you do not know the answer and just look at it. You know what I'm saying? It just saves you so much time instead of trying to write everything down like this, because some things are pretty lengthy. Like, it's a lot of words, or nursing management. Let me see if I find one like this. You know, you may have a lot to write. So I suggest, if you like to write, use a different color pen. If you do not like to write like that, then make sure you write the page number down or the PowerPoint number down. I will say, for the people that do like to write, I still believe you need to write the page number down regardless, just in case you need to refer back to the information that you wrote. So I'm telling you, it will save you time. It will save you a headache if you just write the page number down. If you're able to fit your words, if it's like a short sentence or something, then you can go ahead and just write it on there. But again, write that page number down. It will save you so much time. So you can have all of these inflammations, all of these things that are included with the UTI. And instead of writing all of those things on the side, you just put a label for UTI. And then you know that under there you will find pretty much whatever you're looking for. You can highlight nurses management, things like that, because you guys know most of your test is about nurses management. Okay. Here I have kidney stones. So I just go through, and with kidney stones, it tells you all the different type of kidney stone, the manifestations, all of that. So, you know, I can just flip straight to what I'm looking for. So whatever the question is asking on here, if it says about the diagnostic test that I just read to you guys, like here about the pre and post procedure care of these, then I would just go to diagnostic test in my book, and then bam, it's right there. Another one that I have is bladder dysfunction. So that's urinary incontinence and urinary retention, things like that. I also have acute kidney injury and chronic kidney disease. All of that's right there. Why? Because it's a lot of information on those. You don't want to make a ton of different tabs. And then once we move to a different section, say we're doing, I believe we're doing something else. Let me see. So I believe we're doing cancer and stuff next. So once I get to that section, I will make that a different color sticker, and it won't be up here. I'll probably place it a little bit under or down here. You know what I'm saying? So just so I know, and I make it all the same color for whatever section we're going over, because then I know, okay, well, the green is going to be urinary or kidneys. You know what I'm saying? And then like cancer is going to be pink. So make it easy for yourself. Don't make it harder for yourself. This is easy to do to label your book. If you necessarily don't want to go through and write all the page numbers down, honey, we can get around that. You don't have to write all the page numbers down. You can just label them in your book, and then when you go through your questions, you can always just go to that section and then read whatever it is that you need to read in your book. So save yourself some time. Don't think you have to do all of these tips that I'm telling you about, but I'm telling you because I want to give you options. And you may want to do all three. You may want to do all of the things that I'm telling you. Whatever works for you, you know what I'm saying? So I'm all about saving time on studying, and that's what I like to do. So moving on from that, I'm going to hit on note cards. So note cards. Now, I'm not a big note card taking type of person, okay? That's just not my thing. Sorry, my table was dirty. My son was in here for school, honey. I should have wiped it off. But I'm not a big note card person. Like, I don't like writing a lot of information on my note cards. I feel like I just get too overwhelmed. It's too much information to look at to try to remember. So I try to make my note cards very short and to the point. So like me, most of my note cards that I do are either lab values that I need to know, and I put on here, and then I write the name, what it is, hematocrit. So I have the initials or the abbreviation, then I'll put it on the back. I'll put the values, and then I will put what takes place, depending on what unit we're talking about. But we're talking about urinary, so it'll just let me know something quick and short. So if I'm studying, okay, what's the lab values for this, and why, if it's low, what is the reason why it's low? You know what I'm saying? So make it short. Like, don't overcrowd your brain. Sorry, I'm trying to make it look a little uniform, but don't overcrowd your brain trying to do it. Like I said, I do mostly this. Now, if I do decide to put something other than lab values on my note card, then like, let me see. I'm trying to grab some stuff so you guys won't be like the diets. I still can't remember these, y'all. I'm still working on these, like the foods and stuff. But like a low sodium renal diet. Okay, well on the back, I just put what is considered high sodium. You know, something, this is stuff that they can't have. Foods high in sodium. Okay, that's pretty much what I put. So then I know if it's low sodium, then they can't have these foods. Like, so if I see these on a test, like they say, oh, they're going to have pizza or a frozen dinner, then I already know, okay, no, that is processed. That's processed food. It has a lot of sodium. They're not supposed to have that. So I know that is not the answer. I'm trying to see if anything else. Acute kidney injury assessment. Like I said, I just kind of get to the point. But some of these are kind of common sense because you're going to do vital signs with a lot of things. You're going to do I's and O's, anything dealing with the kidney or circulation. But definitely with the kidneys, you're going to do I's and O's. And since we're on the urinary, then of course it's going to be urine color. You're going to check that, skin color. It's like basic things, but I still wrote it down just because I feel like sometimes when you're taking a test, you can get so overwhelmed that you forget the basic things and you think the question is asking you something harder than what it is. So if you see something basic on there, most likely if you know that's one of the treatments or the things that you assess, then you might want to pick that. Even though it may seem like, oh, that's probably wrong, it's probably not. So that is like my tip when it comes to note cards. So we're going to move this right along. So one of the biggest tips I use is get lost in your thoughts. This is when you sit at quiet time and you just think. This is the moment you take to realize, like, what do you know and what do you not know by not looking at the book or any paperwork. So you would pick a topic. For example, I'm going to do UTI, urinary tract infection. And I would just think in my mind, like, what is it? Okay, well, it's an infection in your urinary tract. So it could be in your bladder. It can ascend to your kidneys, in your urethra. Can't get that out. But it can be any part of your urinary system. So then the next question I would sit and ask is, what do my patient look like, or what are some of the signs and symptoms? Well, they're going to have some pelvic pain. They may have burning urination, some blood in the urine, etc. And then you would think, what do I do as a nurse? Now, you would look at some of your nursing interventions. You would just think, like, okay, well, I'm going to assess the patient. I'm going to ask these questions. I'm going to order a culture and sensitivity test, get a urinalysis, provide pain medicine. So those are kind of some examples of just sitting and just thinking in your mind and just really allowing yourself to really think out the process without looking at any papers or books. You can close your eyes and do this when you're laying in bed at night, and that will kind of let you know, okay, well, do I really know this topic? If you are stuck and don't really know the answers, like when you ask yourself, okay, what's the UTI? You know that part, but the signs and symptoms, you're like, oh, I'm not so sure. Then you may want to look that up. Make a mental note or write it down and make sure you study that and take a look at that, because you may just be struggling with that part. You may know everything else, so you may not have to study everything else. So that is a tip for you. So just think and let your mind wander, let it flow, and see exactly what you know without looking at anything. So yeah, so I really hope this helps you guys. If you want to see a part 3, which I have tons of tips, then comment that down below. And as I stated before, go ahead and comment down some of the study tips you use. And if you used any of these study tips and if they helped you, definitely put that down below, because I want to know. And like always, I'll see you guys in the next video. Peace.